Hello everyone, today we will learn regarding renal disorders. So, details with these three disorders. First one is the nephrotic syndrome, nephritis and nephrosis. Okay, first thing is the nephrotic syndrome. What is that? Nephrotic syndrome, it is a clinical condition characterized by four clinical features. First one is the proteinuria, hypoalbuminemia, hyperlipidemia, edema. These all are the four clinical or the classical features for the nephrotic syndrome. Which all are the causes for this nephrotic syndrome? It is usually caused by damage to the cluster of tiny blood vessels that is called glomeruli of the kidneys. Okay, in other things, minimal changes. This is focal segmental glomerulosclerosis, amyloidosis, certain medication and infection, medical conditions, systemic lupus erythematosus, membranous nephropathy, blood clot in the kidney or the vein, then diabetic kidney disease. These all are the causes for the nephrotic syndrome. Other causes are diabetic kidney disease. In that, diabetes can lead to the kidney damage, that is diabetic nephropathy, that affects the glomeruli. Minimal changes disease. This is the most common cause of the nephrotic syndrome in the children. Minimal change disease result in abnormal kidney function, but when the kidney tissue is examined under microscope, it appears abnormal or nearly normal. The cause of abnormal function typically cannot be determined. Focal, then focal segmental glomerulosclerosis, characterized by scattered scarring of some of the glomeruli. This condition may result from the another disease or genetic defect or occur for the no known reason. Then next is the membranous nephropathy. This kidney disorder is the result of thickening membranes within the glomeruli. The exact cause of thickening is not known, but it is sometimes associated with the other medical conditions such as hepatitis B, malaria, lupus, and the cancer. Systemic lupus erythematosus. This chronic inflammatory disease leads to serious kidney damage. Then amyloidosis. These disorders occur when substance called amyloid protein accumulate in the your organ, means in the people organ. Amyloid build up often affect the kidney, damaging their filtering system. Next, blood clot in the kidney or kidney vein. The renal vein thrombosis, which occur when a blood clot blocks a vein connected to the kidney, can cause medical condition that can damage your kidney. Certain disease and condition increase your risk factor for developing nephrotic syndrome, such as diabetes, lupus, amyloidosis, and other kidney diseases. These are things that damage the kidney. Certain medication, some of the medication also damage the kidney. That is, example of medication that can cause nephrotic syndrome include nonsteroidal anti-inflammatory drugs and drugs used to fight infections. And these are the example for the medication that damage the kidney. Next is the certain infection, which are the infection that damage the kidney, cause the nephrotic syndrome. So for that example of infection that increase the risk of nephrotic syndrome include HIV, hepatitis B, hepatitis C, and the malaria. This is the infection that damage the kidney. Moving on to the pathophysiology. Due to any etiological factors that can damage occur to the glomerulus capillary membrane, due to that the plasma protein, loss of the plasma protein, that is albumin, occurs. Due to that hypoalbuminemia occurred. that leads to the liver produce the proteins, that is albumin plus cholesterol, that leads to the hyperlipidemia, that leads to decrease in oncotic pressure, that water escape from the circulatory system into the interstitial system, that leads to edema. Okay, of course, due to the water escape from the circulatory system into the interstitial system, that leads to edema. Decreased volume of blood, due to that also decrease the venous return and decrease the renal blood flow and the GFR. That leads to the renin activates renin angiotensin aldosterone system to compensate for the decreased blood volume and GFR rate, increase in the blood pressure, that is sodium and water retention, that leads to the hypertension and the anemia. Then on the other hand, loss of plasma protein, hematuria or the proteinuria, loss of the immunoglobulin increase the risk for the infection. Then clinical manifestation. The for that proteinuria, hypoalbuminemia, hyperlipidemia and the edema. These four are the first clinical manifestation for the nephrotic syndrome. Then hypertension, oliguria, then periorbital edema on the arms, abdomen and the legs, then breathlessness due to the ascites, anorexia, weight loss, mild anemia also. Then diagnostic evaluation. So in that first we can take the history, then physical examination, blood investigation, urine analysis and the TP biopsy. Urine analysis, that proteinuria that increased greater than 3.5 grams in 24 hours increase the WBC. Then blood investigation, in that albumin less than 2.5 gram per day. Then cholesterol, that is greater than 200 mg per day. Then renal biopsy for microscopic changes. You can see the microscopic changes into the biopsy. Then management, how we can manage the nephrotic syndrome. So first thing is maintain the protein level, albumin transfusion, increase the protein in diet. For the maintain the protein level, we can transfer the albumin or we can increase the diet for the protein. Then reduce the edema. For that, we can give the diuretics. Then reducing the hyperlipidemia. For that, low saturated fat diet, that is butter, cheese, and yogurt. Then prevent the kidney damage. Corticosteroids also we can use then antihypertensive ACE inhibitors. Then nursing engagement. How we can manage? Carbohydrates are given to provide energy to reduce the catabolism of protein. Input-output chart to be maintained. Fluid, Fluids given are based on the fluid losses and daily body weight. Educate the patient about the disease condition, symptoms, and about the diagnostic tests. We can teach these all are things to the patient or the patient relatives. Educate about the fluid and diet restriction to avoid the worsening of the edema and the hypertension. Importance of follow-up, evaluate such as blood pressure, proteinuria, and BUN and the creatinine levels.